Hello, I'm Director Bang Ji-sung, the hair magician who protects your hair. It's a pleasure to meet you. I'm not exactly the founder, but rather among the first generation in its early stages. I am proud to have made a significant contribution to the optimization of Asian non-incisional hair transplantation, specifically here in Korea. This is truly from my own experience. When I considered non-incisional hair transplantation, the incisional method was very new. Most doctors didn't do it, asking, "What's that?" That was the type of question I'd often get, and because its efficacy and results hadn't been fully verified, there were a lot of negative thoughts and feelings about it at that time. Regarding hair transplantation, I approached it with the firm belief that if performed correctly, it could achieve a superior surgical outcome. These days, patients are already well informed about this. They consider incisional methods, but they also express that non-incisional is superior, causes less scarring, leads to less pain, and produces excellent results. This makes me feel like I truly walked the right path from the beginning, and I take immense pride in that fact. Currently, I don't perform incisional surgery, but we are fully prepared to do so if needed. Since I opened my clinic, no one has requested incisions. Since we've always offered non-incisional surgery, we naturally became a specialty clinic. I also feel more at ease with non-incisional methods. With incisional surgery, there are aspects like post-operative pain or scarring that are beyond my control. But with non-incisional, if I do a good job, I can significantly reduce scarring and pain. I can really minimize them, so I just focus on doing my best. The surgery itself is a bit tough, but the results are much more stable, which actually puts my mind at ease. When I explain the pros of non-incisional and incisional methods, some say, "Director, I want to, but the cost is too burdensome." In that case, let's discuss if we can reduce the hair volume and only operate on the absolutely necessary areas. That way, I try to reduce the cost to tailor to the patient's needs, but sometimes reducing the surgery scope for this person is just not an option. In that case, I refer them to 1 or 2 incisional clinics. What I recommend isn't important. You truly need to meet the doctor. It's the doctor who performs the surgery, isn't it? So for incisional hair transplantation, different directors have completely different ways of thinking. Therefore, I highly recommend consulting the director in person to decide on your surgery. It has a very high difficulty level if done properly, because follicular tissue is less than 1 millimeter in diameter and only 3 to 4 millimeters deep. It's barely visible to the naked eye. But you have to perform the extraction, storage, separation, and transplantation without causing any damage, so the process has to be delicate. If you're not meticulous, you'll make mistakes. Because it requires intense focus, the difficulty level is certainly high. I frequently use this analogy. When I was giving a lecture on non-incisional hair transplantation at a conference, I showed a picture of car racing and explained it. We all drive, right? Driving isn't that hard to do safely, but what if everyone was suddenly told to go and race cars? Since you're a good driver, why not try racing? Some people might be able to do it. There might be someone with guts and skill, but it probably won't be easy for most. Because the speed is too fast, the difficulty too high, and there are far more dangerous situations. Non-incisional is like that. While incisional hair transplantation is more straightforward, it's accurate to think of non-incisional hair transplantation as having a higher difficulty level and being much more complex. Many clinics offering non-incisional procedures are opening. Check the doctor's experience. You should ask the doctor directly how many years they've specialized in non-incisional methods. Ask why it's better. Is it just because of less scarring and pain, or are there advantages in selective extraction and results? I want to emphasize that selecting the right doctor is crucial for an accurate decision. Today we've explored non-incisional hair transplantation, which is an excellent procedure. If you are interested, I strongly recommend that you have a consultation. Thank you.